So the earlier parts of the trial, we've compared patches to ADT in terms of quality of life, and broadly the quality of life is slightly better on patches, but with different pros and cons. So fatigue is less, for example, but gynecomastia is worse. The sexual interest is better, and hot flushes, or flashes as you call them, are also better. So we've done that piece of work. We've done a separate piece of work on bone density. So as with postmenopausal women, you preserve bone density with estrogen as opposed to losing it on ADT. It's self-administered, which means you don't have to go to your family doctor to have an injection once every 3 months or whatever. The downside is you have to keep replacing the patches. You've got either 2 or 3 patches on at a time. They can produce skin reactions, so that's a potential downside, but not a massive one for most of the men. Compliance was very good. So we think it's an interesting new option. I mean, it's not a sexy new pharma drug. It's a very old drug, but just because it's old doesn't necessarily mean it's not an interesting new innovation in terms of how we're using it. And as I said, the cost savings are substantial. Now, if you're self-funding your medication, that's potentially very attractive.